this lesson, we're going to talk about hypothyroidism. You can already start to guess what it is by the name. Hypo always means low or not enough, and obviously we're referring to the thyroid gland. So hypothyroidism is a condition of decreased secretion of thyroid hormones. So we'll see decreased T3, T4, decreased free T4 hormones, and we'll also see increased levels of TSH or thyroid stimulating hormone. Why is that? Let's review again how these hormones get secreted. The hypothalamus in the brain releases thyroid releasing hormone. That goes to the pituitary gland, which releases thyroid stimulating hormone, and then of course goes to the thyroid gland to stimulate it to release the thyroid hormones. When those thyroid hormones are high enough, it sends a signal back up to the hypothalamus to tell it to stop releasing. That's a negative feedback loop. So when these levels are actually super low, then that negative feedback loop never happens. And so this releasing hormone and this stimulating hormone just keep going up and up and up, trying to compensate and trying to get us more thyroid hormone. Now, there's multiple causes of hypothyroidism. One of the most common ones is Hashimoto's thyroiditis, which is an autoimmune disease. Iodine deficiency, because all of these hormones are created with iodine. So if they don't have enough, they can't make the hormones. But also if the patient has their thyroid removed altogether in a thyroidectomy, that will cause hypothyroidism or a hypothyroid state. So what does that look like in our patients? Well, it's decreased thyroid hormone action. The thyroid hormones are responsible for increased metabolism, growth and development, and increased catecholamine effects like epinephrine. So overall, the biggest thing we see is this decreased metabolic rate. Now, anytime you think hypothyroidism, I want you to think hypometabolic. Hypothyroid, hypometabolic. Everything is low or slow. It's like a sloth. Things are happening just very slowly, and that can cause a lot of problems for the patient. They could have a low temperature and cold intolerance. Think if you're already freezing and someone touches you with like a cold bottle of water, you're going to freak out, right? Now, since their metabolism is super slow, they're going to see some weight gain. They could see some peripheral edema. Their appetite's going to be very low. Okay, so they're going to see some anorexia, and even their blood sugar can be really low because the body is struggling to metabolize and break down the glycogen. So you end up with not enough blood sugar. In the cardiovascular system, we'll see bradycardia and hypotension. You've got slow heart rate, low blood pressure. You've got low blood counts. Okay, everything is low or slow. Even in the GI system, it's super slow. So you're going to see some constipation, possibly even some nausea and vomiting because that gastric motility is just not moving. And just like we saw in hyperthyroidism, we're going to see the goiter. Now, again, this is that bulge in the neck. The difference is this time it's due to the iodine deficiency. All these other chemicals that normally come together to make the hormones with the iodine, they'll come in, but then they can't make the hormones. So they just build up in the thyroid, causing the goiter. So both hyperthyroidism and hypo will have a goiter, just for slightly different reasons. So you have to look at the rest of the clinical picture to actually understand what's going on. Now, other body systems will be affected too. In the neurological system, we'll see lethargy, fatigue, weakness, muscle aches, paresthesia, low and slow nerve to muscle impulses, right? Their skin's going to be dry and pale. They're going to have puffy eyes. They'll have the loss of body hair. Things just aren't growing. Things aren't moving the way that they're supposed to. Sometimes they'll even get this blank expression on their face because of the weakness in their muscles. And then, of course, as with most diseases, there is a possibility for an acute exacerbation. In this case, it's called a myxedema coma. So again, low and slow, think coma is they're not moving, they're not responding. It is a life-threatening condition. Their heart rate can dip extremely low. Their blood pressure can dip extremely low. So it's really, really important that we recognize this and address this as quickly as possible. Could be caused by an acute illness, not taking their medication, or even hypothermia can trigger this myxedema coma. So we need to teach our patients not to stop their meds without talking to their doctor first and to avoid these triggers. So when we're managing hypothyroid patients, we can do a radionuclide scan, just like we did with hyperthyroid. We're going to give them that radioactive iodine. And what we're going to see is it's actually not going to uptake the iodine like it would have if it was normally functioning. You can see how pale that thyroid is. So if the patient is hypothyroid and we see that decreased uptake, those decreased thyroid hormone levels, increased TSH levels, we're going to put them on hormone replacement therapy with Synthroid. Levothyroxine elevates thyroxine levels, right? Or Synthroid, synthetic thyroid hormone. Okay, so we want to give them that replacement, monitor those hormone levels, make sure that we don't overdose them or send them a little too far and overcorrect. We're going to want to monitor their heart rate and their blood pressure. We're going to give them IV fluids to help support their hemodynamics, try to keep their blood pressure up. We want to maintain that open airway, especially with goiter. Remember, that's right at their neck. It has the possibility with the swelling to cause problems with swallowing or breathing. Again, with a really bad goiter, we may even consider having tracheotomy supplies available at the bedside. With the hypoglycemia, we want to give glucose or dextrose as needed. And then, of course, we want to encourage good nutritional intake. I know it's really hard to encourage someone to eat more or eat better when they're gaining weight because their metabolism is so slow, but we need to educate them about how important good nutrition is and that they need to trust their medication and take their medication every day. Now, our priority nursing concepts for a patient with hypothyroidism are still going to be hormone regulation, thermoregulation, and nutrition. They are hypometabolic. So we want to make sure they have high quality nutrition intake, that they're taking their meds appropriately, and that we're monitoring for and preventing that myxedema coma. Make sure you check out the care plan attached to this lesson for more detailed nursing interventions. So let's recap. Hypothyroidism is a state of decreased thyroid hormones. So we see decreased T3, T4, and free T4, and an increase of thyroid stimulating hormone trying to compensate. There's multiple possible causes. Hashimoto's thyroiditis is one of the most common, as well as iodine deficiencies or full-on thyroidectomies. Remember this word hypometabolic, hypothyroid, hypometabolic. Their blood pressure's down, their heart rate's down, temp's down, metabolism is slow, everything is low or slow. So we want to make sure we replace those hormones, give them that synthetic thyroxine, and support any kind of symptoms, support their hemodynamics, and make sure we prevent that myxedema coma. Hey guys, so those are the basics of hypothyroidism. We have created a cheat sheet for you to help you learn the difference between hyper and hypothyroid, so make sure you check that out. Now go out and be your best selves today, and as always, happy nursing.